Good morning.
Good morning.
Welcome to Let's Talk About It Tuesday. And today we're going to talk about medications that causes hair loss, okay? And I hope that someone or any of you all will enjoy this informative information that we are giving. We're all certified hair loss practitioners for the state of Alabama. And what our hopes for this is to be able to give information to you to help you understand what's going on with this epidemic of hair loss, okay? So let's get started. All right, Stephanie.
All righty. So,
Well, I'm sorry. Let's introduce ourselves.
I'm Stephanie Nevitt, hair loss practitioner.
I'm Suzette Robinson, hair loss practitioner.
I'm Twana Jackson, hair loss practitioner.
Yes, we just want to come to you this morning and just kind of educate the professional and the client on some medications that may trigger and cause hair loss. As a professional, during your initial consultation, you should ask the client anyway what kind of medication they're on, so you can just figure out the side effects to it, because some of the side effects to different medications is hair loss. And then there are ways that you probably cannot stop the hair loss, but there's ways that you can slow it down.
Yeah, you can
Exactly.
retard it. Now that you said that, many people have come to the clinic here, and the first thing they say to me is that I know my medication don't have anything to do with my losing my hair. Well, because we're at this place where we can educate them and help them understand what is happening, once they realize, because they haven't read the side effects or don't quite understand what the side effects are saying, they don't know that it has an effect on their hair. But anything that you eat, anything that's in your system is fed to your hair. So you all, one thing I'm noticing that one of the biggest things that I see here at the clinic is high blood pressure medication.
Yes.
Oh yes.
High blood pressure medicine has become one of the biggest ones that I deal with. So when people come to you all and you all are dealing with them, what do you tell them if they come to you dealing with the high blood pressure medicine?
First of all, I suffer with high blood pressure.
Okay.
And I'm on medication right now, and my blood pressure goes up and down. And one of the things, like I tell my clients and stuff, you do not have to stay on the medication. You could, all depends on the doses of your medication, will determine on whether or not, if you will have hair loss. Everybody does not have hair loss when they're on a beta blocker. It depends on the person. But the beta blockers put toxins in your body,
Absolutely.
and your hair follicles attacks it because it's toxins, and that's where the hair loss comes in at. But there's other remedies that you can do, because I have thickened my hair back up. It's not as thick as it was, but it has thickened back up by feeding my body from the inside out to combat the toxins that I have.
Okay.
So you could go to a nutritionist, because some foods you can and cannot eat, and you need to go to a nutritionist to see what is proper protocol for the medication that you're on, because some foods you can't eat. But for me, I'm fairly healthy except for my high blood pressure, and I know what foods I can eat, like dark green leafy vegetables.
Absolutely. Those are very important. But I want to say this. I'm glad you brought that up. This is one reason why it's important as a practitioner. My thing is, don't be one-sided with your education. If you're going to learn it all.
Yeah.
That's why I always have continued education. I'm always in school. I mean, and I'm telling you, a lot of times people don't know I'm in class because I don't
Exactly.
talk about it. But the reason why is because I realize that it's very important that all that you think you know is not all there is to know.
Yeah, exactly.
So you have to remain open to learn. So when clients come, and they do come,
Yes.
and I can't tell them because I'm not their physician. Okay,
Exactly.
we work alongside with the physician.
Exactly.
And so, when I realize that they're on these medications, I can't tell them, hey, don't take your medicine. We don't do that. But what I do is learn what I could tell them to help counteract or help lower that pressure so that they may take the dosage down. And to some people, it has happened, they took them off the medicine.
Oh yeah.
So here at our clinic, we have a person that's certified, that's a nutritionist, that helps with that part. And I'm gonna tell you, you can't be one-sided, because when people come, they're coming looking for answers.
Exactly.
One reason why they so quick to jump in a wig or have tracks put in is because they want to cover what they're lacking.
Yeah.
But we found out that's becoming a problem, and it's causing more harm to the body.
Yes.
It's causing more harm to the body. So that's why it's important that we learn about beta blockers. Now, a lot of people don't even know what beta blockers are.
True, they don't.
I mean, they don't. I mean, sometimes I know when I go to my doctor, sometimes he's talking, I may not know anything that he's talking about. And so I'll ask him questions. Well, what do you mean about this? And what is this? And what is that? And so I'm glad that you brought that up, because like Tawana said, she is, and I think in one of our classes we talked about the high blood pressure medication, and I told her of a regimen that she could use, and I'm sure she's been using it because she's getting results of it. And you get those answers when you come into the clinic, because like she says, everybody's not the same.
Everybody's
So
not the same.
we do have to check you and try to see exactly what's going on with you before we try to say anything. That's why I don't get on the phone to try to give answers, because I don't know what your issues really are until you come in and we check you out. But since we're on that, let's talk a little bit about, I know we talk about female hormones, but guys have hormone problems too.
They
Yes.
They really
Am
do.
I right about that?
They
They
really
do.
do.
They have hormone
Big
problems.
testosterone.
Do you want to
Take a
talk?
lot of testosterone.
You want to talk a little bit about that, Stephanie?
Well, yeah, hair loss, as far as male and female, can have male and female pattern baldness due to imbalance of hormones. You might not be on medications, you might eat clean, great diet, but if your hormone levels are out of whack, that can cause hair loss too, because your hormones really affects a lot of your body.
Yeah.
Your function, your hair growth, just thriving, developing. Hormones does triggers hair loss, especially if you don't have those levels in check. I work for a great functional medicine doctor over in Homewood, and she would do a bioidentical hormone replacement for
Okay.
clients, and that had issues with thyroid and hormones, and she would balance those hormones out, get them on the right hormone levels and thyroid levels and everything. Dr. Farrah Sultan, great functional medicine doctor, but she specialized in that kind of treatment, and a lot of people hair came back thickened up, but you have to get those hormone levels and thyroid levels checked.
Exactly. Because when you don't get your thyroid, your iron, and all that checked, they have side effects on your health. And the first side effect showing that you are sick of any kind comes through your hair, nails, and skin.
Exactly.
And those are the proper things that you need to pay attention to. Because if you notice, when you go to the doctor, first thing they look at is your hands,
Yep.
and they look up at your hair, and they check your skin.
Mhm.
They're not telling you they're doing that, but they are doing it. Plus, those are signs. When I went to the doctor for my blood pressure, I went because I got stuck in the foot at work with a comb, and I need a tetanus shot.
Wow, baby.
While I'm telling them about my foot, he looking at me saying, "You going on high blood pressure medicine?" I'm like, "No, I'm not." My pressure was out the roof. They was looking at my eyes and my skin. Then they looked at my hair.
Wow.
So those are the prime culprits to let you know when you are sick.
Exactly.
So when people come into us, I could tell whether or not when you need to go to the doctor. I need for you to have some blood work done. because of the dryness of their hair, the brittleness of their hair, and the shedding of their hair. Your hair sheds anywhere from 80 to 100 strands a day. But when you have excessive shedding, dryness and brittleness at the base of your scalp, there's something going on. When your scalp is inflamed, itchy, burning, there's something going on. Therefore, you really need to go to the doctor and see what is going on. And a lot of times that's through blood work. We can't give you blood work, but we can suggest go see a physician because there's something going on within your body.
Now, I will say this. This is what has happened in Alabama here at our clinic. I've connected with a lab, so my clients can actually get blood work done and they will fax it to me. I love the fact that I work with the physician. Physicians now recognize hair loss practitioners when we're certified, when we do things correctly, you can get the job done because I can't administer that in the clinic, okay? And I wouldn't dare try because I don't need anything else to happen to the client, but working along with the doctor, right now at St. Vincent Hospital, a lot of times I go there and I work with the cancer center there. But what I'm saying is that those of us that are certified go through the proper channels of getting everything done. So when you need this extra work done, you'll be in a position to connect with the hospital, to connect with the doctors, and talk professional to them where they can talk back to you. And you'll be surprised how your business will actually flow. Okay? Because, and I realize we do need blood work done.
Yeah, we do.
We've checked for iron levels. Found out one of our clients, I think, had an iron deficiency.
Oh, wow.
And some things that seem so difficult be so simple when you go through the proper channels. Now, I'm going to bring up something that I keep hearing. Y'all hear people talk about gout?
Oh, yeah.
Yes.
Okay, gout is one that, I didn't really know what gout was. I had an aunt who had gout. And when she began to tell me what it was, I started reading about it, only to find out this. The medication for gout that's used to treat arthritis, okay, known as gout, can cause telogen effluvium. Now, y'all know I ain't pronounced that right.
Telogen
Effluvium.
effluvium.
I was going to get it right.
Oh, yeah.
Thank God for Google. But you know what? When people come in and they talk about their medicine, and I often look at their name brands along with the generic ones, it helps me understand what they're lacking. When you find out what medications they're taking, and then you find out what the side effects are, it helps explain why they're losing their hair.
And you can get the manufacturer's warning side effects from your pharmacist.
Absolutely.
So don't be scared.
Yeah.
Don't be afraid to ask
for
questions.
it.
Ask questions. Ask for it. Hey, let me get the side effect, the
And
warnings to
most
this
pharmacists
medication.
also give you, when they give you a medication, they give you
They
that
put the
paper.
They give you a
They
big
put the
Read
leaflet.
that paper.
But
Yes,
a lot of
it's in
times
it.
we'll throw it away.
Yeah.
Yeah, you
I've
need to
been
read
guilty
that
of
paper.
that. Now, I've thrown some stuff away, and I really should have read it. And because you can, and it goes back to just taking time out to read. We live in a society where everything is quick, fast, and in a hurry. So we tend to do ourselves like that, even when it comes to our hair. You name it. We want it done now. But, y'all, it's a consequence behind that quick fix.
Oh, yeah. Oh, yeah.
Okay, now I'm gonna bring this up because I deal with this. My sister, I have a sister who has seizures from time to time. Then I have a client who has a metal plate in her head, and I realize the medication that they take, they got to take it. Okay, they must take it. But being a professional, you need to know how to handle them when they sit in your chair.
Exactly.
Okay, because there are certain ways you can't shampoo their head.
Certain pressure points you cannot touch.
And that's why I tell students when they take the class now, we do pressure, we go over the cranial, we study the head, we learn the pressure point. There are areas you can't touch. You will cause them to have a seizure sitting in your chair.
Yeah, you will.
Okay, and you could cause them to lose their life. See, this is how serious this has gotten.
Oh yeah.
And so I'm very cautious of that. And so I try to educate those that I talk to about that because it's very important. When you don't know, you don't know.
Exactly.
But y'all, let's deal a little bit about gout. Let's talk about the 10 foods that triggers the gout. Okay?
And number one food, red meats,
Yes.
pork.
Y'all like red meat, don't you?
Pork.
Yeah.
Lets off a lot of uric acid.
Yeah.
It overproduces more than what your body does anyway.
Absolutely.
And that uric acid go right to the joint and inflames it, redness, sore. I mean, so but some people have issues with gout.
Yeah.
So me personally, my body cannot break down pork and red and beef at all. So I have to try to stay away from those things. If not, it will trigger some issues, stomach
Absolutely.
issues,
Yeah.
things like that.
Well, let's deal with wild game, scallops, organ meats. Well, y'all know organ meats. When I start reading about that, I like liver. And they tell you if your blood is low, you need to eat liver, you need to do this. Well, I suggest that you do beets. Okay?
Beets
yeah.
is better.
Beets is hot.
Oh yeah.
I mean, it's really good and it will build that blood level up. And for those of you that can drink some red
I
wine,
do
They can
beet
do-
powder
yeah,
in my
yeah.
smoothies.
Yeah.
Oh yeah.
I have started adding beet powder into my
to your
smoothies.
smoothies.
And it's
Okay,
also
good.
will help with your blood pressure.
Okay,
Because
yeah.
since I've been doing smoothies, my blood pressure does go up and down. And half the time I crashes. So I have to really keep checking my blood pressure because if my blood pressure is normal or below normal,
Oh yeah.
I really can't take my medicine, but I can't get off of my medicine. So I have to do what the doctor say when it gets that way because they are ringing me off.
Mm-hmm.
I'm getting winged off because I would not be on this medication by next year.
Okay.
Yeah.
So, but beets is very healthy, not only in iron,
Yeah.
but it's good for your blood pressure. It has good potassium in it. It helps you a lot. So finding good ways to eat healthier
Is important.
It's important.
versus
Very
the
important.
fried.
Yeah.
When you go to a restaurant, just pick up the fried stuff. Look at the healthy stuff to eat.
I like
There
that.
are healthy. I love the fried, but there are more healthier foods that you can eat that will help not only your hair
Yeah.
but your inner body.
It
You
was
feel
just total
better.
person. Well,
You feel better.
here's something else. Now, some of y'all gonna really give me thumbs up on this. Beer.
Yeah, beer. A lot of people.
Yeah, beer.
A lot of people can't process beer, but they know they can't process it. I worked with a guy. He knew he couldn't drink beer, but he would drink his beer and then he would feel awful.
Yeah.
And then beer
afterwards.
causes fluid around your midsections, which causes more problems with your liver.
Okay, well,
Yeah.
let me name some more. I'm not done. Y'all, let me finish that. Let's see. Sugary drinks.
Oh.
Sugary drinks, certain veggies. And if you want to know those certain veggies, you inbox us and I'll let you know about that.
Yeah.
Certain fruits. Now, I'm gonna get on the fruits. I have a friend who brought something to my attention. When you getting grapes, don't get the seedless ones. Everything that God made has a seed in it. So you got to kind of process this. Now, if you're gonna do things right and natural, then eat correctly.
Mhm.
Move away from the seedless grapes, okay?
Yeah.
What else I want to bring about? There are certain dairy products
Oh yeah.
that are not good for the body.
Oh yeah.
So people that I know that are dealing with gout, sometimes you want to tell them, so look, if you can change your eating habits. I don't really like the word diet.
Yeah.
I don't like that first
Lifestyle
word,
change.
DIE. But
Yeah.
you know, if you can kind of change, that's the first thing I would just suggest to you is changing your eating habits.
Oh yeah.
And that takes discipline because when you're used to eating fried foods,
Yeah.
that y'all keep telling me,
And they
about,
make you happy. We know that.
Yeah.
But
But
see, once
if
you
can
start
just cut back,
changing,
just slowly.
you
Yeah,
don't
just-
want it anymore. And then when you do and go start eating it,
You-
because like
you
when
feel
I did a
horrible.
lifestyle change and I start eating, you know, like
Yeah.
some of that food make me sick now,
Yeah.
so I can't.
It's
eat it.
because you've gotten used to.
Yeah.
See, once you know what, we've trained ourselves to eat a certain way.
Yeah.
Now, I want you to just work with me on this one. I'm looking at the epidemic of people losing their hair. And, you know, you got to look at vitamins. There are certain vitamins you got to be careful about. I think it's vitamin E.
And vitamin A.
I mean, yeah.
Too much
Well,
vitamin
not
A.
E, it's A.
Vitamin
I'm
A.
sorry. Yeah, because you have too much of it. See, a lot of times people say, I'm going to be healthy, and they just go to the store and get C, D, E. They get everything on the shelf. And you got to be careful with that, too, because really, the vitamins that you need to take, you need to find out what your deficiency is.
Exactly.
And that's what you need to take.
Exactly.
Don't just do it. We're going into this healthy thing. It's almost like a fad people are going through.
Yeah, but you got to know what
But
you're eating.
we got to be careful what we're doing because the effect of it, we're losing a lot.
Yeah.
Okay. I wanted to go to something else. Antidepressants.
Oh yeah.
Antidepressants is a #1 problem. Okay. People are dealing with more anxiety, and when I see children taking antidepressants, something is terribly wrong. Yeah, but you know, they got all these different ones. Fluoxetine is one that I was taking. Okay? And my edges, of course, they still kind of thin, but I believe the Lord gonna restore them. But
They're getting better.
Yeah, they are getting better.
I was
They
taking
getting better.
fluoxetine, and the side effects to me are more horrendous than the problem. Okay, so I had to learn how to come off of that. Now I'm not telling you to stop taking your medicine, but I'm talking about what works for me.
Exactly.
And so I learned how to drink teas and stuff like that to keep me calm or to put me all my faculties together. And then I realized I needed a life change. The way I was doing things was totally wrong. Lack of sleep. You got a lot of things that harm you and cause you to lose your hair. But we're talking about medications today.
Yes.
So, with that being said, you all.
And when it comes to the foods, different meats and vegetables and things like that, if you figure out what your blood type is,
Yeah.
figure out what your blood type is, and then you go from there.
Amen.
Because different blood types
Require different types of food.
require different types
And
of
it's
food.
hard to buy. But you have to.
It really is. And then when you figure out what your blood type is, because like I said, some blood types, people, stomach acids does not produce
That's
enough
right.
Exactly.
to break down the foods for you to absorb the nutrients and proteins and stuff for your body to absorb it. So you need to find out what your blood type is first, and then you go from there and have you a food sensitivity test done.
Absolutely. And you know what? The reason why we're, I think this is very important. I think that from last week, I want to just really take time to thank those that contact us. They had some valid questions.
Yes.
And the reason why we're going to continue this because we got such a big response from last week. And I'm grateful for that. I appreciate your questions. I thank you all for taking the time to even listen to us. It's so much we could talk about, but I only have a short window to do this. But I'm grateful for this time. And so I do welcome your questions and your comments. We can take it all. And so, you know, but my initial thought for doing this is this. If we never talk about it, we'll never get an answer to it.
Exactly.
There is a solution to every problem. Okay? And the only way you're going to find out or get that solution, you got to talk about it. And when I go to the stores or just anywhere, it's not a day I don't see somebody suffering from hair
Yes.
loss.
True.
And, you know, you want to just kind of talk to them and try to get, you know, their attention. And we're here to help. We're really here to help. We're not saying we got all the answers, but we're willing to learn and help those that need. But what we know it.
Yeah.
And so here we get to see a lot. People come in. I see some things I've never seen before.
Yeah.
And it make me research and find out what could I do to help them. Some I can help and some I can't. That's why it's important, even in this hair loss industry. I'm talking to professionals now. It's very important that you continue get the education that you need, because we're facing situations and different types. It's not just about alopecia anymore.
No.
And that's all you. Well, I got alopecia, and then you ask them, well, what kind? And they don't know.
Or it's family hereditary.
So sometimes some things are so simple
Right.
as you're taking some medicine and not knowing that the side effects you're losing your hair.
Exactly.
Okay? And yes, you could talk to your doctor about it.
Mhm.
I mean, if something's going
Don't be
on
scared.
with your
Ask
medication and it's working against your body, you better say something.
Yeah.
Don't sit there and just let it go on.
Because they don't know if you don't say anything about it.
And
Exactly.
So, but
Or they know and just won't say nothing because you ain't saying nothing.
Exactly.
absolutely, they think
They
it's
think
okay.
you're okay with it. So
Because you can go to your physician all day and get your blood work drawn. They'll come back and say, oh, your blood work looks great. Nothing's going on. and they see that it's something else going on. But
Yeah.
and sometimes you need to look at your blood work for yourself, because
Exactly.
what they
Know what
say
you're
is
looking at.
great. If you're borderline, to them, sometimes some doctors they say, okay, yeah, you're okay. But sometimes borderline is not
It's
good
not
for
good
your
at all.
hair. So you also need to get a copy of your blood work and learn what you're looking at and
Exactly.
where it should be
exactly.
to be more healthier instead of if they're borderline.
Now,
Yes.
one thing I can say, when you come to the clinic in Alabama, and I get your blood work, we sit down and talk about it.
Exactly.
And I allow you need to ask questions. And and the thing that I love about this is an ongoing situation.
Yeah.
Mhm.
We're continuing learning, and we're going to continue to do a great work for those
Exactly.
that need us.
Exactly.
Now, our time is winding down. And once again, I want to thank you for tuning in to Let's Talk About It. We will be here
Next Tuesday.
Next
at
Tuesday.
10 o'clock Central Time. But I also want to say something. What's coming to Alabama is we're getting ready to have a wig building class. And it's coming to Birmingham. Greg Bazemore presents Intro Hands-On Class, Build Like the Pros. These are custom wigs, units for your clients. These are not wigs that you glue on. These are not wigs that you sew to a net. These are real live units. These are the units that's also approved by the prosthetics that we use for the cranials. These are approved. So if you're interested, please inbox me. Here's my telephone number, 205-503-9916. My name is Suzette Robinson. You can also get in touch with Mr. Bazemore. His number is 202-489-4247. Once again, thank you, Stephanie. Thank you, Tawana. Thank you. Looking forward to talking to you all again. Please send in those questions and we will address them. Thank you so much. Have a blessed day.